Hi, and welcome back to Pills and Bills. If you've ever suffered from migraines or had a headache that just won't go away, then you might be familiar with the drug we're reviewing today. We're looking at Fioricet, which is a combination of acetaminophen, butalbital, and caffeine. This combination med is often used when standard over-the-counter pain relief is not enough, and it does this by combining two drug classes, a non-opioid analgesic and a barbiturate. And then we have our standard PharmaLink phrase, which is a quick memory hook that your brain can latch onto so you can remember the brand generic pair more easily. As mentioned, Fioricet is often prescribed off-label for migraines, but isn't considered first-line therapy due to the risk of dependence and rebound headaches. Interestingly, Fioricet can actually worsen headaches over time, specifically with overuse of the barbiturate component. Fioricet works best for tension-type headaches, but as mentioned, may be used off-label for migraines. Another quick memory aid for the brand name as well as the use is to think Fioricet finds relief. You might know that drugs containing a barbiturate are typically federally scheduled controlled substances. Interestingly, Fioricet is not because it's combined with other ingredients and present at much lower doses than usual. So federally not controlled, but there are still some states that regulate it more strictly. Flipping to our mechanism, acetaminophen works by inhibiting prostaglandin production in the central nervous system. If you'd like to deep dive and better understand prostaglandins, we have a high-yield review earlier in the chapter. Butalbital works by enhancing GABA A receptor activity, an inhibitory neurotransmitter that helps calm the central nervous system. Caffeine works alongside these to block adenosine receptors, which leads to cerebral vasoconstriction, which is important because vasodilation can be a key contributor to headache pain. Moving to our major side effects, nausea may occur as the brain normally helps regulate stomach movement and nausea, and CNS depressants like barbiturates can disrupt that control. In addition, acetaminophen and caffeine may irritate the gastric lining. This is also the reason why abdominal pain may occur. Dizziness is also a common side effect. It is also due to the CNS depression from butalbital. It can slow brain signaling that's involved in balance and coordination. CNS side effects like dizziness can be even worse when combined with alcohol or other sedatives. Moving to our warnings, Fioricet carries a risk of dependence because the barbiturate component, butalbital, depresses the CNS and activates the reward pathways with repeated use. Over time, your brain can become reliant on it. Frequent use may actually lead to more headaches, where stopping the drug triggers rebound pain and perpetuates the cycle. As mentioned, butalbital can suppress the central nervous system. It should not be combined with alcohol, opioids, or other sedatives because these effects stack. When used together, you can increase your risk of excessive sedation, accidents, or respiratory suppression. And that completes our review. See you next time.